Hi, my name is Stephanie Caballero, and welcome to the 9th episode of the IVF Parent Podcast series. Today's episode, I have the pleasure of welcoming Dr. Rahi Victory of Victory Reproductive Care, who has helped so many families achieve their dream of having a baby. He is not only a highly respected fertility specialist who is licensed in the United States, Canada, and the UK. Seriously, he's a bit of an overachiever is all I have to say. He also does OBGYN, so he delivers babies as well as helps create them through IVF and artificial insemination. He's really somebody that I've known and worked with over the years, and I think you will really enjoy his perspective. And he is from our neighbor to the north in Canada, so I'm really honored to have him. And like I said, I hope you enjoy this episode. So without further ado, here it is. Thanks so much for listening and watching if you're on YouTube. I'm so excited to talk to you because you're one of my favorite people. You do great work. And I did not know, did I not know this, that you're licensed in both Canada and the US? Did I know this? Did I not?
I am licensed in Canada, the US, and the UK.
So there you go. So since you're licensed in both, but you're in the UK, what do you see are the differences between, well, now all three, right? Canada, US. Obviously, we don't really have health insurance to cover IVF, so that's probably a
Right.
huge difference. But what do you see? Like culturally, logistically, you know,
Yeah.
yeah.
I think Canada and the US are way ahead of the UK. I think we tend to do a better job of listening. I think we tend to do a better job of adopting new technologies. And I think we do a better job of investigating as well. I can't say that that's true everywhere in Canada or the US, but I think generally speaking, my gestalt would be they do a better job. The UK is very pedantic. It's top down. I'm the doctor. I'm the god. Don't question me. I know what I'm doing,
Mm.
and we're just going to keep doing it until it works. There was one physician that was part of an NHS program, who, of course, shall remain nameless, who told their patient, I don't care if it takes 15 cycles of IVF to
I've
get you
heard that.
pregnant. We're just going to keep trying until it works, which to me is horrific. I mean, I don't want to do 15 cycles of IVF. That's insane.
Horrific. And of course, he's never done them. I was in Brazil, and this doctor, who will remain nameless, said, oh, yes, it's fine for them to do 22 cycles and not go to donor eggs. For you? Because not for me,
Yeah.
right?
Yeah.
Oh, that is
We're
interesting. I think you're right because of the competition, it has made the doctors not doctors as God. Yeah.
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 So,
So I don't believe in that model. My philosophy is let's figure out what's wrong with the situation, whether it's male, female, both,
right.
whatever. Let's explain it to the patient so they actually deeply understand it. And then let's give them the options that are available for them to correct it. Sometimes it's natural, right? Sometimes it's IUI, sometimes it's IVF, sometimes you need a donor or you need a surrogate, whatever the case is, but
Right.
explain it to people and let them choose. Don't force everybody into IVF.
No, and I tell people all the time, I don't speak doctor. I'm not a physician because when I
Yeah.
was going through IVF, there were some things he would say to me and I'd go, could you say that in English? Because yeah, I'm not understanding what you're saying to me right now. Yeah.
Yeah. No,
You,
that's really important. It's important to make sure patients understand. And, just going back to the question of differences, we do a way better job of that in North America than they do in the UK. In the UK, they don't even explain. When we go to the show which is coming up in a week or two in the
yeah,
UK,
Yeah.
when I attend that show and then I speak to the patients, they'll say, I've had 5 cycles of IVF. And I said, well, what did they tell you is wrong? And they go, nothing. We don't know what's wrong. I'm like, what? What do you mean you don't know what's wrong? What happened? Like, why did you need IVF? We don't know.
We
What
don't,
happened with your IVF cycles? We don't know. You
it,
mean they didn't explain to you why you got 0 embryos? No. Was it egg quality,
yeah.
sperm quality? We don't know. Like, just total blanket, coverage of zero. Like, it's just all shrouded in darkness. And I'm sitting there going, well, I don't know how to help you. I don't even know what's wrong.
Right. That I haven't been in a lot of many years, and I can't go this year. I was going to go. My daughter is graduating.
Oh, congratulations.
Yeah, thank you. So, but that explains why there were so many women in their mid 40s coming up and asking to do IVF again, because that's what
Yeah.
they've been doing the last time I
Yeah.
was there. That does explain it. Okay, that's good to know. I
Yeah,
mean,
I just did a podcast the other day with a lovely lady from the UK. I think she goes by the Fertility Hero or something like that.
uh-huh.
And she put out a post yesterday and it hit like 55,000 views today. It's like just crazy. There are so many people that are just in the UK that are just starving for information, right? It's amazing. So yeah, I
Yep.
think we do a better job here, which is part of the reason I want to go to the UK because I want to bring our model there and help those people get the same kind of results we're getting.
They need you, clearly. Yes. So we know you do a lot of cross-border work.
Hmm.
I know you do a lot of cross-border work.
Yeah,
So definitely there's legal and medical factors
for
because I
sure.
think some people think, oh my gosh, how hard is it for me to have my cycle in Canada and have my surrogacy or my egg donor be somewhere else,
Right.
right?
So I think that it's really important for people to know a couple of things about that. Number one, it's actually exceptionally easy to have their cycle in Canada, whether it's their egg and sperm and they need a surrogate, or an egg donor and someone's sperm and they're doing it in themselves, or again, a surrogate. It's very, very easy to do in Canada. It's way, way less expensive. And the most important thing, because we hear this all the time and I get a good chuckle out of it, is that a lot of clinics in the US will say to the patients, oh, they're not as sophisticated as we are, or they don't have the same technology that we do. I will happily put my tech and my, performance up against any US clinic any day. I mean, our overall success rates overall are in the 70s. We probably have some of the highest success rates in the world. So it's not for
Yeah.
lack of skill or technology. We're trying to do cutting edge work all the time. We just end up doing it for less because things are cheaper here.
They
So,
are cheaper. Yeah. I
yeah,
wonder if it's because of our insurance system. Even though most IVF is not covered by insurance,
yeah,
I think it has to play a role somewhere, somehow.
it does. I mean, I think the average cost I find for a US IVF cycle is about 25,000 US dollars, sometimes a little more.
It's more
Sit
now.
up.
It's more. No, no, you don't need to sit up. It's
Oh, oh,
more.
oh, I'm sorry.
Higher. Higher.
Wow. It's even
I
higher
think
than
you
that.
could still get like the Midwest and smaller clinics. I think you can still get 25, but there's some that are 35, 45,000. Yeah. And
So
then
just to put that into perspective, that's more than 3 rounds of egg retrieval, including the meds and the retrieval and one transfer and storage and the PGT for us.
yeah.
Like it's such a huge difference.
Yeah.
Like I look at that, I'm like, why are they gouging people?
Yeah.
I don't get it.
I, I think just everything costs so much for us here. I mean, that's part of the reason. But I mean, honestly, private equity. Private equity has bought up almost all the IVF clinics. For
That's
the
right.
people that don't know, they've sold part of their practice.
Yeah,
And when you sell to somebody else, then they are looking at all the costs and they're saying, okay, your employee cost is this, this is this. You need a profit margin that's here, and you might have been here.
right.
So who pays for that? The patients.
Patients. Yeah, that's
Yeah.
absolutely the case. I agree with you. The same thing is happening in Canada, and it
Mm.
has absolutely dwarfed the UK. All the clinics in the UK are owned by PE or VC, all of them. And if you open one, it immediately gets snapped up by one of these PE or VC
Yeah.
groups. So I think that there's no question that being independent and not having to answer to anybody makes a big difference for us. I think our location is really great for our
I think
cross-border
so
stuff as
too.
well. Yeah, so it's super easy. People fly to Detroit, they're at our place within 30 minutes, which makes it really
It
easy for them
does. There's
and
a
nice.
lovely, nice bridge to go right across. So they can have like the fun, good food and hang out in Detroit, maybe
Yeah,
see, a Detroit Lions hockey, whatever game,
yeah.
hang out there. Yeah, whatever. No, I think that for you, that makes it really, really easy,
Yeah,
right?
yeah, we love
So
that about
yeah, so you have like this multidiscipline, you can tell I did some research. This
it.
holistic, I came prepared because you have a naturopath doctor, which most clinics don't, and you have a social worker.
We do.
So,
Yeah.
so tell me, why is that? Why? Why do that? I mean, I could probably figure it out, but I'd like to know.
Yeah. We have a very holistic approach to things. I think people do better when you address them as a individualized person rather than like a cookie cutter medical approach.
Yeah.
And, with all due respect to all of Western science and medicine, including all my colleagues, we're great at some things. IVF, sure, we're really good at it, but like I had not heard the term microbiome until a few years ago when one of my fertility patients said, "Oh, my microbiome's messed up." And I was like, "You're what?"
Like,
Like,
what? What is
we didn't
that?
learn about it, right? We didn't know about it. It wasn't part of our training. No one paid attention to it. It was never on the radar. And so she told me about it and I got into the microbiome and I very rapidly realized the naturopaths had been dealing with this for decades and we didn't even have an inkling about it. So I realized it's going to be way better for my patients if I bring in the experts that already know how to deal with this stuff.
Oh, so that's it. Okay, so explain to those who don't know what microbiome is.
So we know now that the bacterial, viral, and fungal, like yeast, content of the vagina and the uterus are critical to the success or failure of your IVF cycle, or even naturally. And so if you have the wrong combination of bacteria, you have a lot of bad bacteria, not enough good bacteria, it can really interfere with your success rate. So we've developed testing. So we actually work with a company now called Concevium Biotech, which does the testing for us. And we get a really clear read of exactly which bacteria are there, how high is the percentage of the bacteria that are there, are they resistant to specific antibiotics? And then we know exactly what to treat those bacteria with so that we can restore normal balance for those patients. That naturopaths just are better at doing that than we are. I know what to do, but I have naturopaths because they reduce stress, they improve diet, they're great at
Yeah.
microbiome, they're good for the immune system. They can kind of heal patients with a whole other approach than what we use.
And I have to say, as somebody who's gone through IVF, to have that kind of person there for me would have been so helpful. Just even to reduce stress. Because I remember reading, it was like my millionth IVF cycle, and you know how stressed your body goes into flight or fight, and it's harder to become pregnant. And I just wanted to throw a chair at the window. Obviously, I was
Sure.
still stressed. Because how do you get rid of stress when you're trying to have a baby and you can't have a baby? Like, yeah.
No,
Thank you.
it's almost impossible, right?
Mhm.
So that's where they can come in very handy. They're actually very good at stress reduction.
Yeah.
Most of our naturopaths all do acupuncture. Our social worker
Okay.
is great because she actually directly one-on-ones with our patients and offers them counseling and ways to kind of de-stress. And she actually teaches them techniques that will help them reduce their stress and help them cope, right? And that's a big part of it. Whether I have a friend that's a PhD in fertility psychology, and she's a brilliant young lady, Dr. Julia Sen. And I interviewed her one time. She said something that really struck me because I had never thought of it. She said, even when the patients are successful and the baby's like literally in their arms, they're so traumatized by what it took to get there, they're still carrying that trauma with them.
Oh,
Success does not erase the trauma.
it never leaves you. Truly,
Exactly.
it doesn't.
Yeah.
Infertility has never left me. I can go right back to that place. Like,
Yeah.
and be there in a hot second. Yes,
Right.
I have my children. Yes, I'm not doing that grueling hamster wheel, IVF, 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 IVF. This time it's going to work, right? But yeah, that trauma, and they liken it to, a death, going through divorce.
Yeah.
They do. And then you feel
Yeah.
so lonely because, you don't know so many people that are doing it. And then people say they want to be kind, but they don't think that I'm sorry is enough. And trust me, I'm sorry is plenty. We don't need your advice.
No, no, I agree.
And then they
I
hurt.
think
Yeah, yeah.
I think having those resources available, whether it's a psychologist or the naturopath, or even being taught the coping strategies, just makes the difference for patients between the roller coaster ride and at least being buckled in versus, you're going down the roller coaster with your hands in the air and you don't know if you're going to fly out when it goes
Right.
upside
Because
down.
your seatbelt may or may not work. You're like,
Yeah. Yeah.
okay,
So
yeah.
they need that extra layer of comfort, protection, support. And we
Truly.
we really believe in providing that.
Truly. Even the surrogates and the egg donors, especially if they haven't done it before, right? I mean,
Yeah.
I could see that for a surrogate or an egg donor. It's because people don't understand for a surrogate, and I know you work with a lot of surrogates and egg donors, they don't understand that if something happens, they feel it almost more than you do.
They
Like,
do. I had a call with a surrogate today. We did some advanced testing for her and found out she wasn't a great candidate, unfortunately. And, she was crying because she felt terrible that she had, um, sort of failed her intended parents.
right.
And I said, look, you're a wonderful person. You've done so much to make this work. We love you. You're actually wonderful to work with. This is just biology. It has nothing to do with you. But she felt it, like deeply personally, she felt it.
Deeply. They do. They do. See,
Yeah.
now I know that's how you balance all the high-tech IVF, state-of-the-art stuff with patient empathy. Because really, at the end of the day, we're people. That's what I tell my clients, your patients. We're people, and it's biology. So,
Right, right. And biology is not math. You can't expect that one plus one equals two in biology. Sometimes it doesn't. You have this and you have that, and you think it's going to work, and it doesn't work out properly. So I think that's really important. I have to say I will kind of toot the horn of my team.
ooh,
Our team is really very good at taking amazing care of the donors and the surrogates. We tend to get everyone kind of reporting back to us saying our experience here, whether it's been positive outcome or negative outcome, has just been outstanding. Even the surrogate I spoke to today, she said, "You guys have been so wonderful, so positive, so easy to work with during this experience." And I love that for my team because they're there on the ground level doing the day-to-day stuff. And I love the fact that they are really caring about the patients that we take care of. That for me is everything. I want us, regardless of whether you're successful or not, I want people to walk away from the experience saying that was a really good experience for us.
that matters because at the end of the day, yes, the intended parents are paying for it, but if they're doing third party, you're right. That's your patient, that's your patient, that's my patient, right?
Right.
You owe a duty of care. Like no matter if I'm representing the intended parents, the donor, the surrogate, I owe a duty of care to them.
That's right.
Of
That's right.
course, I want an amazing, wonderful cycle. Don't we all, right? It seems like there's a lot of bumps on the road
There
today.
are. There
I'm
are for sure.
I'm not gonna lie. It just seems that way right now. I don't know why. We've got to figure that out for sure. Try to make it more streamlined for sure.
Yeah, I mean, especially in Canada, we know that it's difficult to find surrogates, which is why we love working with you because you can facilitate those US hybrid journeys for us, and I
Yeah.
think that's great. And it's just easier, right? Like it takes no time. We can find surrogates quickly. They're really great surrogates, and they're all happy coming here for a quick trip, and we get them pregnant and we send them back. So
You
it's
know,
lovely.
you were so right. So many of my clients, because I talk to them in the beginning, sometimes they just find me and then, they want to ask about all these things and I'm like, no, surrogates love to travel. Don't
Yep.
think they don't travel. In fact, if I get a contract, one of the first things I ask is, okay, where are you going? like they, family reunions and trips and vacations. And one time we got this with this contract back, and the steward goes, "Oh, I'm going to go to Japan." We're like, "Oh no, you're not."
Yeah, yeah,
Right? Oh my
for
gosh. And
sure.
then you also do research.
We do.
So,
Yeah.
right? So, yeah, I don't know how you sleep. Wait, you don't sleep.
What's that?
What is that?
Yeah, we don't sleep a lot. Yeah, I love staying on the cutting edge. So we're doing randomized controlled trials in some things. We did a world's first about a month ago,
Oh,
where we retrieved an egg with no medication and turned it into an embryo from a much older woman.
whoa, whoa,
Yeah,
whoa, whoa,
yeah.
whoa.
So we're
No
experimenting with that.
medication?
Zero, not even a trigger shot. Yeah. So
Wow.
we've been experimenting with that. We need to fine tune it, but we're working on it. And that actually is the future because they think they've got a handle on how to reduce the number of genetically abnormal embryos, but you have to mature the eggs in the lab to do it, to get the eggs to be normal. And in order to mature the eggs in the lab, you have to know how to retrieve them immature. So we've gotten quite good at retrieving the eggs. It's not easy, it's actually very difficult. We've gotten
I,
good at retrieving the eggs, but the maturation process is the part we're still working on. So we're trying
oh,
to finesse that.
I
Mhm.
would not know that. I would think that it's the egg part, but so is that the biggest game changer that you see in the next 5 years? Is that it?
Definitely. If we can fix that, and we've started research on how to correct the genetics, which hopefully we'll have answers to within about a year or two, it'll change the whole face of IVF because you wouldn't take meds anymore. You would show up, do an egg retrieval, expose the eggs to these substances that correct the genetics, and then you would do your ICSI, make the embryos,
Oh
and
my
now
God.
instead of being 42 and getting no genetically normal embryos, you would get them all or most of them to
Oh
be
my,
genetically normal.
you're
It's a
right,
game changer.
because we take the meds, and at any given point, a woman has a million follicles, eggs, we're just going to call them eggs, but,
Sure.
right? So if you can take those and get those, then nobody has to take those meds. Nobody has to, I mean, you still have to go through a medical procedure, but you wouldn't feel like you've got watermelons sitting there that are about ready to explode.
No, you literally take no meds. It's like, hi, how are you? Can you show up tomorrow for your egg retrieval? It's literally that easy, like very, very facile. No, no difficulty at all. The egg retrieval for the patient is easy. The egg retrieval for the doctor is very challenging because instead of going for these follicles that are like this big, it's like 3 millimeters and you got to get the needle right in there. So it is
Yeah,
not easy.
that is not easy. That
No,
is
it's a
not
very
easy.
challenging
So
thing
does
for the
it, I mean, I'm under anyways, and I'm not gonna lie. You know what I was given just made me all like, woohoo, great time. So I didn't mind that part. Some people have
Yeah,
a bad reaction to anesthesia,
sure.
but how long is it? Because I know for the doctor, when you like pump them full of, sorry, you're not really pumped full of hormones, but I would tell you, as somebody who's done a lot of egg retrievals, you feel like you're pumped full of
Yeah,
hormones.
yeah, yeah.
But
No, that's accurate.
it's all balanced. It's all right, because you're tested all the time. Anyways, so it's about 10 minutes for you. I mean, it's a million hours for prep for the
Right.
patient, but so this procedure, how long does it take?
Probably about 15, 20 minutes
Oh,
to do an egg retrieval. Yeah. It's
oh.
not too long. It depends on how many eggs they have, but
So it's not that much longer with this new technique.
no.
Wow. Okay. That is, dang, that's going to be huge. I'm
Yeah.
going to be super excited for that because,
Yeah, we're doing a bunch of different research projects. We're looking at the microbiome. We're doing testing on immune factors. Um, there's a whole bunch of different things we're looking at. So I love that part of it. The, hey, what can we do to make it better for people? And let's prove that it actually helps. I think that's big.
because they said I had the immune factor. I had one of the worst. So I did IVIG, which,
Yeah.
for people who don't know, they call it liquid gold. At the time that I was doing it, it was $2,000.
Yeah.
And you had a little IV stuck in you, which seemed like 12 hours. But I was going to do anything to try to get pregnant and have a baby. So funny. And then now I had a surrogate, and I'm like, why was that so important? but at the time it was. So that is still, because I have to say that it was controversial when I did it,
Sure.
but my physician did tell me that the people who test like we did, I've never seen them get pregnant.
Yeah, it's quite challenging for some of the patients with immunological problems. We've
Yeah.
become really good at treating it. So we have IVIG, there's the same thing, but it's called sub-Q IG. We have drugs called tacrolimus, sirolimus, which are really potent. They're drugs that we use for anti-rejection, like when you get an organ transplant.
That's
But a
kind
lot
of what
of,
I think I had. You know, I didn't
yes,
have the immune system, so instead of protecting it, my body just went, "Ugh."
right, exactly. So sometimes your immune system thinks the embryo is just like an organ that doesn't belong to your body and it attacks it to get rid of it. So we now have drugs we use exactly for organ rejection control that we now use for embryos. And those work really well. And then we have some stuff you don't have in the US, like it's called leukocyte immunization therapy, where we will sensitize you to your partner in case you're not sensitized, because sometimes your immune system doesn't really recognize your partner's proteins. The embryo lands in there, it's half your partner's proteins, and your immune
Yeah,
system goes, what the hell is that? Let's kill it. And we
yeah,
can now
that's what mine did.
sensitize you so you don't attack. So there's lots of treatments now that really can change the success rate for those patients.
See, I needed all those things.
Yeah, and many do. So you're in good company. Yeah.
Right? Because, when the transfer with my surrogate happened, she was pregnant and, did the ultrasound at the same time when I did it. And I was like, wow, those are huge. Because if I got a heartbeat, it'd be like this big. And they'd
Right.
say, yeah, yeah, yeah.
Makes a
Uh,
big difference.
yeah. Okay. So we hear a lot about natural IVF
Yeah,
and there's IVM, and then can you explain for those uninitiated,
sure.
what's the best? Why do it compared to
Absolutely.
traditional? Yeah.
So IBM is the process I was just talking about where we retrieve the eggs immature and we mature them. So it stands for in vitro maturation.
Got
So
it.
that process is being developed. It's been around for a long time, but it's becoming more sophisticated now with new techniques and new culture media. So I
Yeah.
think as we scale that up, we'll get better and better at it.
Yeah.
Natural cycle IVF is really great for women where you've done IVF, you're not making a lot of eggs, or you took a lot of medication and your egg quality was terrible. Many of those women just don't react well to the drugs. We've actually developed genetic testing to tell us whether or not you'll respond well to drugs. We can actually tell you ahead of time.
So then they could just pivot to natural IVF.
Exactly. It's much cheaper. It's way easier. You need barely any medication.
Yes.
And typically we get really beautiful embryos from it because they're not exposed to these meds. I see people, actually just before this, I had a patient. She has done 6 rounds of IVF in Canada, Lebanon, and Turkey. She told
Wow.
me that in the cycle she did in Canada, of all places, she was given 600 units a day to try and make eggs. And that's proven harmful. Like no
Oh,
one should be doing that, right? It's
gosh,
so
that
harmful
poor
to the egg.
woman.
Exactly. And then I said, "What happened?" She said, "Well, that was my worst cycle." And I said, "Well, of course it was. You were blasted with these meds."
Yeah.
Some of those people do infinitely better by taking almost no medication, getting a couple of eggs at a time, and now you get these beautiful, happy, healthy eggs, and they actually become really nice embryos. So
Perfect.
that's what natural cycle IVF is.
Yeah.
Almost no medication, or you can actually try it with no medication at all. It's finicky. We usually do like 3 days of super, super low dose Menopur or something like that. You do the retrieval, you get a couple of eggs, you turn them into these gorgeous embryos, and now the patients do way, way better. And it's much less expensive. Like we charge, I think, $7,000 to do a natural cycle IVF,
Wow.
which is five
Yeah.
grand US, right? So it's easy.
Yeah, that's easy. That I would raise my hand for that for sure. I
Yeah,
would,
exactly. Yeah.
right?
Yeah.
Okay, since you're on the cutting edge, you review medical journals and everything, what would you say is the biggest myth around fertility that you would like to debunk? with your patients? What do you see
From
them come in with that you're like, no?
So the biggest myth is probably that IVF just cures everything. So I think there's this idea out there that if you're doing IVF, it's just going to solve all your problems. Don't worry anymore. You're going to be great. And whether you have endometriosis or male factor or horrible egg quality or whatever the case is, don't worry because IVF is going to fix it. And because they're not paying attention to the details, you may be successful with IVF, but it's going to take you 4, 5, 6, 10 tries instead of one. And that really drives me crazy because we're doing the patients a huge disservice. We're exposing them to financial risks, time risks, emotional risk, relationship risk for no bloody reason. Like, why don't you take the time to optimize endometriosis? It makes a huge difference in
Oh,
success
that's what
rates.
I had. Yes. Yeah, it
Yeah.
does. Yeah, it makes a
And
huge
it,
difference.
And people are told every day, don't worry if you have endo, the IVF will overcome the endo. IVF makes endo worse. How does it overcome it? Like it just makes no sense. So I
Yeah.
think this idea out there that IVF will cure anything and everything, it was designed to make people do more rounds of IVF. And that's to me, that's not medicine. That's just pure business. And I
Yeah.
just refuse to practice that way.
Yeah. Okay. That's good. Yeah. And I have to say that I think some people going into it believe that they're going to, everything's going to be fine. You're right. I'm going to get the eggs and we're going to get the sperm and we're going to have some embryos. And I remember my doctor saying, oh, no, that does not happen every time. I'm like, oh, it
No.
does. No, no.
No, not at all. I mean, we have loads of patients. That same patient I told you about that did the 6 rounds elsewhere, she had severe endo. And every single time she did her egg retrieval and her embryo transfers, they were all cookie cutter protocols. Nobody did anything for her to specialize or individualize for the fact that she has a severe endo. And
Oh,
it's wildly different, right? Like you need a whole different approach for those
you
patients.
do. And I had mild to medium, which is kind of the same. I was told for pregnancy rates, but
Right.
severe,
It's a different story.
different story. Like
Yeah.
that poor woman.
Yeah, yeah, exactly. So we love individualizing. I don't like the idea that everybody should get the same care. You're different from the next lady next to
Hmm.
you and the
Yeah.
next one and so on. And so I believe we should really be looking for the answers for each patient and customize the care to that patient to get them what they need.
Well, absolutely. That's what they want. That's what I
Exactly.
want.
Yeah.
Exactly. At least when I was going through it, I would sit down after it didn't work, which my doctor thought I was a slam dunk. Yeah. 13 IVFs later and, almost 8 years, there's a slam dunk. Um, but yeah, but he would always meet with me and we would talk, and he told me I needed a surrogate. I wasn't ready. So that's why I tried the IVIG and all these crazy things. And then finally I was like, okay, I'm done. I cannot do this to my body. I was like taking Viagra suppositories, handmade,
Right.
like 4 times a day. One time
Yeah.
I'm at work and it went in the toilet and I had to fish it out of the toilet. Don't worry, I hadn't peed yet, people. But if I had peed,
Wow.
I probably still would have fished that out. I'm not gonna lie. And it was giving me these headaches and
Yeah.
it was just the crazy things I did. I can't even begin to tell you. But you're
Well,
right.
patients are desperate, right? Like they'll do anything. I literally tell people like, if I told some of my patients to go outside my office and lick the bark off the tree out there because it's going to help them, they would do it, right? So
I,
these
totally
patients are desperate and
desperate.
they want help and they will do anything we tell them to.
Anything, anything. Yeah. Yeah. We get a little, it all calms down afterwards, but we get a little,
It does, but you know what? It emphasizes for me the importance of honesty and transparency and
yeah.
caring about the patients because they are so vulnerable, right? Like literally they will do
Mm.
anything or spend anything to make it work. And that's
You,
why I think
mm,
fertility doctors need to hold themselves to a higher standard because we're not just dealing with, it's not like you're going to the orthopedic surgeon because you need a new hip, or you're going to the plastic
right,
surgeon because you want whatever, you want new boobs. This
right.
is like people's lives. It's their futures. It's what they got together with their partners for. And and for so many, it's like the foundation of their entire living or their whole future. And if you turn it just purely into this business model where you're basically telling people just keep coming back over and over and over again, I just feel it's like really shameful for us to move in that direction. I want the fertility world to turn back to medicine. Like, let's be doctors. Let's take care of people. Let's give them care that they need and that they deserve instead of just keep endlessly spending more money without individualizing your care.
You're right, because they are incredibly vulnerable. Truly you are. You're just in a different headspace completely in some
Yeah.
ways. Yep.
Yeah, you are.
And that leads me to the fertility journey can be long, as we know,
Sure.
very emotional. So how do you help your team? Like, I know there are times for us, there's some cases that are just really hard, and we talk about them, and it doesn't happen very often, but
Yeah.
you know, I know we're hopeful because for the most part, our clients have success, but there are some times where there are some pretty rough things that happen, for sure.
Yeah. I think it's really important to make sure that you acknowledge what the team goes through, whether it's the patients or our own
Right.
employees. I think it's really important to do your best not to take your work home with you. I think it's hard not to be emotionally invested, but at least be emotionally invested at the office and try not to carry that home with you as much as possible. And then I think it's really, really critical to celebrate the wins. It's one thing to acknowledge the trauma parts and to talk and allow people to vent and work their way through problems. And I always tell my team, like, if you're having trouble with a client or with a patient or a surrogate or an egg donor or whatever the case is, come talk to me. Like, I'll always jump in there and try and smooth things over,
Yeah.
and you got to be good at doing that. But I think it's also really important to celebrate the wins. I can tell you, because we take care of pregnant patients here,
That's
in
right, you
many
do.
we do, and in many instances, our ultrasound techs have picked up things that even the hospital missed,
Oh,
and we've saved babies' lives. I just
oh,
recently had a case where we were monitoring, and they said, this baby doesn't look great on ultrasound. I sent her immediately to the hospital. They got the baby out immediately. And that baby, even an extra 10 minutes, would have probably had a very different outcome. So, those are things where I will get on and tell our entire team in email, this ultrasound tech saved the baby today, or this nurse saved the circumstance today. And I think it's really important. We have a corporate newsletter and we put that out and we celebrate our wins. And I think that's really important to help support people and make them feel good about the work that they're doing.
I think you're right. I think so because there's things that can go wrong, um, you know, I, get so far and something could happen with their surrogate or the surrogate doesn't decide to move forward and stuff. But I'll never forget this case. It took this client 20 years to have their first child. Starting
Wow.
her, yes, 20 years, multiple surrogates. They sent me a picture of the christening, and it's sitting in my office on my desk, always has been. And I think of them as because they've had one of the longest journeys I've known.
Sure.
And you're right, celebrate the wins. So
Yeah.
that is, I gave them help, small part, my small part with the legal. But they have a baby girl. Well, she's not a baby anymore. She turned 18.
Yeah,
You
it's
know, that
critical.
happens. But yeah, you're right. Celebrate the wins. All right, this
Yep.
was amazing. Thank you so
Thank you.
much.